Today we are going to talk about calcium homeostasis. For calcium and phosphate homeostasis, the role is played by three hormones, which are parathyroid hormone, calcitonin, and vitamin D. Parathyroid hormone is synthesized from chief cell of parathyroid gland. Calcitonin is synthesized from C cell of thyroid gland, while vitamin D from kidney. Vitamin D is also called 1,25-dihydroxycholecalciferol. The active form of vitamin D is calcitriol or DHCC, that is dihydroxycholecalciferol. The site of action for all of these three hormones are three sites: bone, kidney, and intestines. Bone, kidney, and intestine are three sites for action of these three hormones, which are parathyroid hormone, which increases serum calcium concentration, calcitonin, which decreases serum calcium concentration, and vitamin D. Okay, now synthesis of calcitriol, which is active form of vitamin D. In skin, there is 7-dehydrocholesterol, which is acted by ultraviolet radiation and converted to cholecalciferol. Now, this cholecalciferol in liver is acted upon by 25-hydroxylase to form 25-hydroxycholecalciferol. Finally, this 25-hydroxycholecalciferol is acted upon by alpha-1 hydroxylase in the kidney to form 1,25-dihydroxycholecalciferol, that is DHCC, also called calcitriol, which is the active form of vitamin D. Now, this DHCC acts on the intestine to increase the absorption of calcium. Okay. The renal threshold for calcium is 10 mg per dl. Now, let us see here. If calcium concentration is decreased in the blood, then there will be increased release of parathyroid hormone from chief cell of parathyroid gland. This PTH causes increased calcium resorption from bone, that is, causes osteoclastic activity of bone. This also increases calcium reabsorption from kidney. This is not bone, okay? This is kidney. Calcium reabsorption from kidney. PTH increases 125 DHCG. This 125 DHCG causes increased calcium absorption from intestine, so that the site of action of PTH is bone, kidney, and intestine. Now, this causes increased calcium in blood. Okay, now let us see. There are two main types of cells in bone. One is osteoblast and another is osteoclast. Osteoblast is bone forming cell, while osteoclast is bone eating cell, that is, it causes destruction of bone. Okay, now PTH. PTH is the function of PTH is to increase calcium resorption from bone, so that there must be bone eating cell activity. So PTH stimulates osteoclastic activity, but the receptor for PTH hormone is present in osteoblast. Let us see the mechanism of action of parathyroid hormone. Parathyroid hormone receptor is present in osteoblast. First, this parathyroid hormone binds to the receptor in the osteoblast, which is G-stimulatory. First of all, there is activation of adenylyl cyclase, which causes conversion of ATP to CAMP. Increased CAMP causes activation of protein kinase A. Now there will be release of rank ligand, which is receptor for activation of nuclear factor kappa beta ligand. Now this rank ligand released from osteoblast causes activation of osteoclast, which is responsible for resorption of bone and finally causing increased serum calcium level. We know that bone has type 1 collagen. We can remember this as spelling of bone, B-O-N-E, 1, that is type 1 collagen is present in bone. Okay, now let's see here. The product of calcium concentration and phosphate concentration in serum is always 40. Always 40. The calcium concentration is generally 10 mg per dl and phosphate concentration is 4 mg per dl. Now let's see here. Bone formation occurs in alkaline condition. That is, in bone formation there is alkaline phosphatase. Alkaline phosphatase is the marker of bone formation, so that bone formation occurs in alkaline condition, but bone destruction occurs in acidic condition. Now, how PTS causes increased absorption of calcium, not absorption, increased reabsorption of calcium from kidney. Let us see here. PTH is also called PTS. We can remember PTS as phosphate tracing hormone. That is, it causes losing of phosphate. Now let us see here. In the nephron, there is DCT part. Okay, in the DCT, when calcium is absorbed here, this calcium enter to these cells of DCT. Now this calcium from DCT, cells of DCT, is moved into the blood, into the serum by calcium ATPase here, and also by sodium calcium exchanger. Calcium is entered to the blood and sodium is entered into the cells of DCT. First, PTS binds to the receptor in the basolateral membrane of DCT. Now this is coupled with GS activation of adenylyl cyclase, which leads to conversion of ATP to CAMP. This CAMP causes activation of protein kinase A. Now this protein kinase A causes activation of these two proteins. These two channels are transporters which causes transport of calcium, which are calcium ATPase and sodium calcium exchanger. There is also another mechanism. PTS also activates vitamin D. Okay, I have already discussed that there is 7-dehydrocholesterol present in skin. UV light act upon this to form cholecalciferol, which is acted upon by 25-hydroxylase in the liver to form 25-hydroxycholecalciferol, finally acted upon by alpha-1 hydroxylase in the kidney to form DSTG, which is active form of vitamin D. Now this DSTG causes absorption of calcium and phosphate both from intestine. In this way, there are three hormones which causes balance of calcium in the blood, which are parathyroid, calcitonin, and vitamin D. The site of action is bone, kidney, and intestine. How PTH works? It is coupled with G-stimulatory protein. PTH also causes activation of vitamin D to form DSCG.